Yeah, we should start. So, a very good evening to all of you. In the interest of time, we will start the session. And today, we are here in this NHRDN session, very important guest with us. We have Dr. Arvind, and you all must have seen him over a period of time on the television sets while he's talking about COVID, the facts about COVID and what needs to be done. And I'm sure personally, professionally, I have learned a lot from his advices. And I'm sure each one of you must have learned that. And today we all are here to learn more from him because we are going to enter a very crucial phase as far as the COVID is concerned. While government has started an unlock, but the COVID has not gone. And it is as dangerous as it was. So we have to be, as HR managers, as people in the organizations who are responsible for not only the health of the employees across the organization, but also everybody in the society, wherever we serve the society by whatever needs we fulfill. Now this session will become very important, and that's why we requested none other than Rajiv ji himself, a life member of National HRD Network, to moderate this session on behalf of all the participants, please. Since the time is at premium, I will humbly request Rajiv ji to please take this discussion of today forward. Over to Rajiv ji, and thank you so much, Dr. Arvind, for joining us. And thank you, Rajiv ji, for agreeing to moderate this session. Over to you.
Thank you, Dhananjay. Namaste to everyone. In fact, it was in March 2020 when, at the request of National HRD Network, we did our first program for the corporates along with Dr. Arvind Kumar on the emerging dimensions of COVID-19. It's been so much of time and we have seen so much of changes, the peaks and the downs, the non-caring part, the risk-taking part, and the sufferings in abundance during this period. In management jargons, we have done many of these conferences where we have debated on during and after COVID, the world of reset, and also gone through the issues of the unknown, the known, and again the unknown. And this roller coaster of our knowledge has continued. Today, we again have the time to have a relook at what has happened, what may happen, and what are the risks that we are heading towards in this conversation with Dr. Arvind Kumar. I'm grateful to Dhananjay, all the office bearers of all the chapters across India, and the national office for helping us think about this program and presenting these thoughts once again with you. I was told that over 500 people have registered, but I'm sure IST is an indefinitely stretchable time, so people shall be joining in due course of time. But let me also take this opportunity to brief you about Lung Care Foundation. We are 6 years old. We are a Guinness World Record holding social impact trust. Behind me on the left, you will see the Guinness World Record. And we created this Guinness World Record when 5,003 children sat together to form the biggest human organ in the form of a lung. And these kids were from 35 schools of Delhi and NCR. The objective was to create awareness and also compulsion in the mind of people to start thinking about the need for happy, healthy lungs. Since then, we have moved a lot. We are focused on 3 things: awareness creation, research, and clinical care. And of course, since the time COVID came into being, we have done over 100 events virtually, reaching out to more than 1.5 million people across India, and also people from 26 countries have participated in our program. And in the last 30 days, we were in a war zone where we could send medicine to around 60,000 people in the rural India, where we created a pouch of medicines which are necessary for the first week of treatment, so that if that could be taken care of, a lot of seriousness could be mitigated. And this has happened to multiple of our partners in the rural India. And we actually could reach up to 14 states of India. And this work is still continuing. With this, let me share with you the format that we shall be following. This will be a question answer session. So I'll be asking few questions to Dr. Arvind Kumar as a starter. I'm your representative, but do send me your questions in the chat box. My request would be to kindly be very brief with your question and don't ask a personal prescription question which we will not be able to handle, because for that you will need to meet your doctor. But any question relating to health, which is generic by nature, kindly do ask very briefly. I may club many questions together to put that question across to Dr. Arvind Kumar. So kindly permit me the liberty of not taking your name, because the question is going to be more important than, I'm sure, the name that I need to take. About Dr. Arvind Kumar, he is the chairman of Institute of Chest Surgery, Chest Oncosurgery, and Lung Transplantation at Medanta Hospital. Before that, he was the chairman of chest surgery at Sir Gangaram Hospital, and earlier to that, he was the professor of surgery at All India Institute of Medical Science. Arvind has been very, very active in terms of giving across his words of wisdom, his caution to people across, and through multiple of his videos, you'll be surprised that Lung Care Foundation has been in a position to reach to almost 20 crore of people in Hindi and English and also other languages which we translated into. Dr. Arvind and I both happen to be the founder trustees of Lung Care Foundation, and today we again present our Jugalbandi before you. My job is very, very simple. I'm only going to be asking questions, and all the tough questions are going to be answered by Dr. Arvind Kumar, and he is the master of that, and he will do that with absolute ease. Dr. Arvind, my first question. We have gone through a period of panic, an absolute panic, where morning, evening, every time we were only looking at the shortage of oxygen, people dying, cremation scenes, and this panic manifolded so many times that it was unimaginable. As of today, what is the situation and what is the likelihood of such a panic returning back to us? Dr. Arvind.
Thank you, Rajiv. Dear Mr. Dhananjay, ladies and gentlemen from HRD network across the country, first and foremost, a very warm good evening and a sincere and humble thanks for giving opportunity to Rajiv and myself, Lung Care Foundation, to be interacting with all of you. We are indeed grateful for allowing us the pleasure of this interaction with you. It's indeed an honor for both of us to be interacting with all of you. So thank you so much. Coming to the question, yes, Rajiv, we went through, I don't know if panic, disaster, horrible. I'm not able to find an appropriate word in English dictionary to describe what we have gone through. I have always taken pride in 35 years of my medical career in being able to help people get a bed when they need one, get admission when they need one, get operation date when they need one. And I always used to think, oh, I can help everybody, having worked in so many hospitals. But these 2 months taught me that nothing is infallible. And there were dozens and dozens of occasions where, despite my best efforts, I could not get people into the hospitals and my friends died. So disastrous, I don't know what was the appropriate word. And I pray to God that not only our country, but no country in the world, no human being in the world ever faces such a situation in time to come. But coming to reality, we went through horrible time. And as the virus numbers rose dramatically, they fell also dramatically. And we are now in the 55, 60,000 range. But I want to issue a note of caution here. It's a very clever virus. It's an RNA virus. RNA virus comes very lower down in the order of species. And these lower you are, the more mutations you undergo because you are in a very crude form. And we already are aware of alpha, beta, gamma, theta, delta, and now delta plus mutations. I don't know how many more mutations are going to be seen in the next few months. We don't know. Nobody knows which way those mutations will go. Mutations may make it absolutely useless virus, not at all clinically relevant, or mutations may make it a lethal virus that it leads to death in everybody that infects. We don't know. It's all in the realm of future. So therefore, as people who have gone through a lot of suffering, what should we do? This virus is very much there around the corner. Last time also in January, February, it did not go away. It was very much there, but we thought it has gone away. We started patting our backs, so we have defeated it, and it hit us when we least expected it, and it hit us badly. We know that. Same thing may happen this time also. And if we want to prevent that, what are the tools that we have? As far as the mutation of the virus is concerned, we have no control over that. The virus will mutate whichever way it wants, whichever way God destines it to. We can't control that. What we have under control are two things. One, we control our behavior, and two, somehow we try and develop immunity within ourselves to the available strains, known strains. So one is COVID appropriate behavior, where there are 4 pillars which are important. One, mask, and the current recommendation is either an N95 mask or a combination of double mask. The inside one should be a surgical mask, double ply surgical mask like this, covering the nose, mouth, chin, and covering adequately on the sides also, not just hanging loosely around the mouth. That's one, masking. Number 2, social distancing, about 2 meters plus. Number 3, very important, not collecting at crowded places. Now we know that it spreads by aerosol, which means when I'm speaking, my mist which is coming out of my mouth is going up to 8 to 10 meters distance there for several hours. And if somebody comes there, he can inhale. Now, what is the relevance of mask? When you wear N95 and like this one, if you wear N95 and I speak, 95% of the aerosol, if it's fitting tightly, 95% of the aerosol gets stopped inside. Only 5% comes out. If Rajiv is there in that room and he's also wearing an N95, 95% of that 5% which has escaped from my N95 will go inside him, which is 0.25. So only 0.25% of my aerosol enters him, which means the dose is very low. If I'm not wearing a mask, 100% comes out. If he's sitting and not wearing a mask, 100% goes inside. So difference is 100% exposure versus 0.25%. So there lies the importance of everybody wearing masks, and there lies the importance of not being in closed spaces, crowded spaces. Open spaces are better, or rooms should be well ventilated so that the aerosol keeps going out and keeps getting diluted. So this was the third pillar. First is mask, second is distancing, third is not accumulating in crowded places, and fourth is hand hygiene. These 4 are the pillars of corona appropriate behavior. And other way to develop immunity is to go for vaccination. Vaccination. Whichever vaccine, Rajiv will ask questions, I'll answer it later. Vaccination, develop the immunity by vaccination, prevent yourself from spreading infection and getting infection by corona appropriate behavior. If we can do these 2 things, most likely we will be able to prevent the third wave from coming. And if we don't do that, third, fourth, fifth, I don't know how many waves will come, and nobody knows how many people it will kill. Rajiv.
Thank you, Arvind. That's a very interesting and exhaustive answer. You've been talking about changing nature of strains. Well, if the strains keep changing, the question comes out at a macro level in India, both from the state government point of view, as well as from the corporate point of view. How well are we ready for it? And what do we need to do to be ready for it? Within the corporate especially. Because these are HR people who can actually make things happen within their own house.
No, Rajiv, you said how well are we ready for it? Means ready for what?
Ready to face the changing strains as well as face maybe what we are talking about, the third wave or the fourth wave. Because
So
every
Rajiv,
wave will bring in different type of complexity.
Yeah. So Rajiv, the thing is, no matter how complex it becomes, few things will remain common. And that is the mode of transmission will remain from human to human. It is through human contact that this virus, whichever strain comes, its infectivity may change, its lethality may change, but the mode of transmission will remain the same. And what I'm asking you, asking all of us, is to do appropriate behavior to reduce the possibility of close human to human contact, thereby avoiding the possibility of transmission. One, which is what I meant by COVID appropriate behavior. And despite all this, if the virus does go into the body, I'm asking for vaccination, because that will develop antibodies, which, if it's a sensitive strain, will prevent the inoculum, which is the virus which is going inside, from infecting the body, right? So one is we prevent the virus from going inside by COVID appropriate behavior, and two, by vaccinating, we prevent the virus which has gone inside from infecting our body. Now, these two things are in our hands. As far as viruses mutation, we don't know. So as corporates, as citizens of this country, everybody's responsibility is to, number one, ensure COVID appropriate behavior by ourselves and by others in our family, in our society, in our office, in our other places. And number two, get vaccinated ourselves and get as many people as you can. Encourage them to get vaccinated. When we reach 70% plus people having been vaccinated, that's a critical mass, after which the virus goes into a negative cycle and the risk of transmission becomes less and less, and the virus tends to die out. Rajiv.
That's very well explained. Arvind, in fact, in National HRD Network and like any other management groups, we are very fond of using jargons. And in fact, I came across a very interesting jargon today called anti-vaxxers. Now, this was something really surprising for me, because I had so far been talking about hesitancy vis-a-vis vaccination. But now with groups like anti-vaxxers coming up who are against the vaccination part, because their logic is that even after vaccination, people are dying. Even after vaccination, people are getting COVID. What is the point of going through the process of vaccination and drawing all the complication? What are your comments as a doctor on this?
So very interesting the name, whatever I find it difficult to repronounce after hearing from you, but there is no need to do that. Vaccine hesitancy was a good enough name.
Yeah.
So there are a lot of factors behind it, Rajiv. Political issues, religious issues, social issues, lot of issues are there. I'm a doctor. For me, politics doesn't matter. Religion doesn't matter. I have only one religion, and that is treating my patients and benefit of my patients. So whatever I'm going to say is based on medicine, based on science as a doctor, not keeping politics or religion in picture. Vaccine is a medicine which is injected into your body, and it's injected into the body of a normal individual to incite an antibody response. The first dose starts it, it goes to a certain level. The second dose acts as a booster and take it to a higher level. And the two doses together give you a good level of antibodies, which protects you from infection. So when the Covaxin and Covishield trials were conducted on 25,000 volunteers each, it was found that people who were vaccinated with two dosages and thereafter exposed to infection, about 75% of them did not get the disease, 25-30% did get the disease, but it was a mild disease. None of them got severe disease. They didn't go to ICU, no ventilator, and no deaths. This was the data we started with in the mid of January. Come second wave, where millions and millions of people, those who had got vaccinated as well as those who had not got vaccinated, got infected. And we started seeing many vaccinated people getting infected. I'm also one of them. I was fully vaccinated, but in the first week of April, I got COVID infection. So did my wife, who was also fully vaccinated. But fortunately, both of us had mild disease, but there were many who had moderate disease, severe disease, went on ventilator, and died also. So initially, we were saying that vaccination is 100% protection against death and severe disease. Today, we say it is a very high level of protection against death and severe disease, not 100%. So coming to a one-line answer of the question, why should we get vaccinated? Friends, vaccination is the most effective method of preventing yourself to a very, very high level from getting severe disease and suffering ICU admission or death. It's not 100% protection, but it's the highest level of protection that anything can provide. Now tell me, when you have something which is available, which can protect you from death to say 95% order, not using that and exposing yourself to the risk of severe disease and death, does it make sense? And what is the price you pay for getting vaccinated? Well, if you look at the data from India, 22 crore plus dosages have been given. There is mild pain at the injection site. There is fever, malaise, joint ache, muscle ache, nausea, or some chills for about 48 hours. Now, please don't go after the reports from the Western countries of clotting, this, that, another. These issues have not been seen or reported in our country. And even the other side effects are to the range of 0.0000002%. Now, tell me, on one hand, you have 95% plus protection from death and severe disease. And on the other hand, you have 0.0000002% risk of infection. Is there a choice? Rajiv.
Wonderfully answered, Arvind. Thank you so much. And let me address the HR friends here. My friends, anti-vaxxers may say anything. Hesitancy vis-a-vis vaccination may be very high. But please, you are the people who are looking after your people, not only in bigger cities, not only across the computers, but also in factories, in smaller areas, where this hesitancy is going to be, again, extremely high. Please understand these figures and make sure that it is not only that the direct employees that you are responsible for are vaccinated, but anyone who comes in contact with your people, and even your badli workers, or the temporary staff or the contracted staff, everyone is encouraged to go through the vaccination process. Only then you will be in a position to look after your own people. And this is something which is crystal clear, which is Dr. Arvind is talking about. And I'm sure he wishes to add something to that.
So just to answer that, I wish to give example of US. US has been the most aggressive in terms of vaccination. More than 50% of the population has received at least one dose. And see the way they are now able to open. They have taken the bold step of saying that we can do away with the mask. Not to say that I'm recommending that at all for our country, at least for the remaining months of this year, even if you have got vaccinated. But just to give an example, that vaccination has allowed that country, which was in a worse situation last year than we were in the month of April and May, that country today has galloped to a situation where most of the states are now allowing fully vaccinated people to roam around without mask. That's the high level of protection which vaccination provides to you. Rajiv.
That's a wonderful example, Dr. Arvind, you have given. And this is what our HR colleagues will also have to understand, that it is not only encouraging people to go through the vaccination process, but also ensure that the 4 steps you talked about as COVID appropriate behavior are really taken care of. We generally get very influenced by what happens in the US. And in fact, the anti-vaxxer is also a US terminology. But if we start thinking in terms of, hey, if they have taken off the mask, can we do that?
No.
No way. And please, being a Punjabi, I also say that let us also not adopt the Punjabi attitude of dekhi jayegi. We'll see it, because that is a real risk that we are taking. And this is the reason perhaps the second wave was very, very strong. And we are on the verge of a third probability. And in case we take those kind of risks, it'll be very terrible. Coming back to Dr. Arvind. Dr. Arvind, your 6M formula, when somebody gets stuck with COVID and has to manage his life and the family, or even take care of the family members who are affected, I'm sure my audience would be very keen to understand what is that 6M approach, because your video actually went viral and has been seen by crores of people. So maybe you could briefly describe that 6M approach.
I will, but Rajiv, just one small digression before I did. I was reminded. So all those people who were born before partition and had the misfortune of seeing all that partition-related violence, always used to say, "Sir, जिस आदमी ने वो समय देखा है, वो images को इंसान जिंदगी भर नहीं भूल सकता." Now, I was born post-partition. I didn't see those images. You also were, but our fathers and other people used to tell us कि उन images को कोई जिंदगी भर नहीं भूल सकता. Rajiv, same way, all of us who have faced similar horror and trauma during the month of April and May, seeing patients dying in cars, in ambulances, bodies lying on the roads, bodies waiting for hours and days to be cremated, Christians going for cremation, Hindus going for burial, bodies being dumped in rivers. Rajiv, who can forget those images? Tell me. So those images should actually make us wiser and request and force us to resort to COVID appropriate behavior. I'm sure nobody would want to repeat that.
Well, you're addressing a very learned audience, and therefore they would be very keen to know about the 6 M's which you've been talking about.
Yes, I'm coming to that. I'm coming to that. So 6M was when we were at the peak of second wave, and a lot of people were calling up for treatment. Doctors were not available. There was no face-to-face treatment. Everything was on tele, home management, etc., etc. And long WhatsApp prescriptions were circulating. That's when we discussed, we actually collated all the data and divided it into 6 M's, which we called 6 mantras, but these are just 2 M's, 6 M's. So what were the 6 M's? Number 1, mixing, no mixing. Number 2, medicines. Number 3, meals. Number 4, mindset. Number 5, monitoring. And number 6, movement to hospital. Now, taking each of these very briefly. So mixing was this year, there were a lot of atypical symptoms like sore throat, eyes congested, body ache, nausea, vomiting, diarrhea, without fever, which occurred in a lot of people, and nobody ever suspected that to be COVID. And people kept mixing, or people went for RT-PCR, which took 2-3 days. And for those 3, 4, 5 days, they used to keep mixing, thereby spreading the disease to the entire family before they got positive. So we said that if you have any symptom during this COVID pandemic, please treat it as COVID and just go in isolation, no mixing. That was first M. Second was regarding medicine. At that time, huge long prescription used to be given, which had some antibiotics like azithromycin, doxycycline, augmentin, which had antivirus like Fabiflu, which had vitamin C, vitamin Z, vitamin D, zinc, lots of other things, and at the end, paracetamol used to be written. And I realized that out of all these, the only thing which is badly needed is paracetamol, because you need it to control fever, which needs to be taken regularly, 6 hourly or even 4 hourly if required. Antibiotics were making no difference. Antivirals made no difference. There was no need for ivermectin, hydroxychloroquine, vitamin C, Z, etc. And rightly so, as expected, now 2 weeks back, Ministry of Health has removed everything from its recommendation. Only thing is paracetamol. So I would say if you're taking normal diet, paracetamol is all you need. This is about the medicines. I'm talking of mild disease, people who are at home. Moderate and severe disease goes to the hospital. There was no indication, no need for anyone to take steroids or blood thinners at home in the mild disease. They are only indicated in moderate severe disease, which anyway will take you to the hospital. So no self-administration. Let me tell you, this epidemic of black fungus, which you saw in the country, US had more cases than our country, more severe cases than our country, but did not have even a single case of black fungus. We had epidemic of black fungus because of misuse of steroids. A lot of it was by self-administration by people. So this was second M, medicine. Third M, meals, very important. When you have fever, appetite goes down, people stop eating. So we suggested that you need high protein diet. If you're diabetic, keep your sugars low, keep your fat low, no smoking, no drinking, a lot of fresh fruits, 2.5 liters of water. And you may not be able to eat few full meals. So please eat something every hour so that you have a high protein intake, which is mandatory. This was about me. Fourth M was mindset. There was huge amount of panic across the country. Everybody's gears were in first gear. And if you keep yourself in a panic, tense, anxious, excited mode, you have a lot of negative hormones, adrenaline, which is released. And if you keep your adrenaline levels high for several days together, it reduces your immunity and increases the chances of your going into severe disease. So we suggested breathing exercises, relaxation exercises, hobbies to be practiced, even during isolation. We said, please calm down, please calm down. 98% of the people will get all right. Don't be panicked. Don't go for unnecessary blood cells. This was fourth M, mindset. Fifth M was monitoring. You monitor your temperature, you monitor your saturation by pulse oximeter, and you monitor your symptoms. If you have high fever persisting, 103, 104 despite paracetamol, if there is ever a fall in your oxygen, and 94 was taken as the lower limit of normal. If you are below 94, you have severe chest pain, you have excessive cough, or you bring out any blood in the sputum, or you have a very fast breathing, or you are having drowsiness, or you have excessive diarrhea leading to dehydration. So I'll repeat, persistent high fever, low saturation below 94, excessive cough, especially if there is blood in the cough, any breathlessness, severe breathlessness, chest pain, unconsciousness, diarrhea. Now, these were symptoms or red flag signs to move to the hospital, which was our sixth M. So, make no mixing, medicines, only paracetamol, meals, very important, high protein, a mindset, please relax, and monitoring, please monitor yourself at home. And if any of these red flag signs, move to the hospital. All this was supposed to be carried out at home in isolation, but under supervision by teleconsultation from a doctor. So this was the 6 mantra video which we had released, which helped a lot of people. Rajiv.
Thank you so much, Arvind. In fact, that video did exceedingly well across India, and we received a lot of appreciation of that video. Now, when we talk about things like anti-vaxxers, but those who go through the vaccination process, I'm sure can be called vaxxers. Now, the question is, vaxxers may also have queries. Now, someone who has already taken one shot of the vaccine and goes through COVID, what is the right course of action for the person?
So Rajiv, can I just answer?
Maybe you could take all of them together, including
related questions in
absolutely
in
one go. That will be wonderful. And may I request also to include lactating mothers and pregnant ladies.
Yes, I will. वो record चलेगा तो सब कुछ
absolutely fine.
Yeah. Actually, you address these things several times every day, so it becomes like a record. So vaccine is either a dead virus or a part of a virus piggyback on some other vector which is injected in your body, in the body of a normal individual, to excite an antibody response and thereby give him passive immunity without his getting the disease. And once those antibodies are there, after that, when the virus enters the body, the antibodies present in the cells do not allow the virus to get a foothold in the cells, and thereby, even if we take infection, we don't get infection, we don't get infected. So this is how the vaccine works. Now, Covaxin and Covishield were the two vaccines which came out of our country. Both were requiring 2 dosages. One dose starts the response and second dose takes the response to the desired level. Now, a lot of people ask this question, who should it be allowed? The government of India today, as of 18th June, allows it to be given to everybody except children below 18 years of age and pregnant ladies. Now, why these two? Because it's not yet been tested to be safe in these groups. The trials are going on. Till we get the result, these two groups are excluded. Till a month back, lactating mothers were also excluded, but on 17th of May, lactating mothers were included in the group. Now, a lot of people have this question that they have diseases, what they should do. Diabetes, hypertension, heart disease, chest disease, asthma, tuberculosis, liver disease, abdominal disease, bone disease, kidney disease, cancer, neurological diseases, soft tissue diseases, muscle diseases. There's a whole long list of diseases that people have. कि सर मुझे ये बीमारी है, मुझे टीका लग सकता है कि नहीं, मेरा ऑपरेशन हो चुका है, मेरे को कैंसर हो चुका है, I have had organ transplantation, I'm suffering from this disease, I'm taking this medicine. The common answer to all these friends is that you can and you should and you must take the vaccine. In fact, if you have any of these comorbidities, your chances of getting COVID and your chances of dying for COVID are higher than the normal population. So you actually stand to benefit more from vaccine than other population. So you must take. A lot of people ask this question, I've got a stent in the heart. Can I take vaccine? The answer is yes. I'm on blood thinners. Can I take vaccine? Answer is yes. The only contraindication for vaccine is if you have active COVID infection or any other active febrile illness or any severe illness which is requiring hospitalization. In that case, you should wait for a few weeks to recover from that. Post-COVID, earlier we were saying about 4 to 6 weeks later you can get the vaccination. Currently, government's recommendation is if you have had COVID, wait for 3 months and then get your vaccination. Now, question is, so when do people take first jab after COVID? Current government guidelines के अनुसार 3 महीने के बाद. You've taken the first jab and then you get COVID. When do you go for the second jab? 3 months after the COVID as per the current guidelines. So this is about COVID and vaccination. There are 2 dosages needed. For Covaxin, the gap is 4 to 6 weeks. For Covishield, earlier the gap was 4 to 6 weeks and it was increased to 8 weeks. Currently, it is 12 to 16 weeks. Why this increase? Because when the international trials data started pouring in, when these subgroups, those who got at 4 to 6 weeks gap, 6 to 8 weeks gap, 12 to 16 gap, when these subgroups were analyzed, it was found that the 12 to 16 weeks group was the one which was having highest levels of antibodies, and therefore it is currently recommended in India that Covishield should be spaced out at 12 to 16 weeks. This is the current recommendation. If you take one vaccine of one type, your second dose also has to be same type. There is no mixing of vaccines. And then people ask this question, sir, Covishield le, Covaxin le, ya Sputnik ka wait kare, ya Pfizer ka wait kare. So friends, all of them are safe. All of them are efficacious. Whatever is available in your town, and if everything is available, toss a coin and go for any one of them. They're all good, they're all safe, they're all effective. Important thing is for 70% of India's population to receive the vaccination ASAP, and please contribute to this national movement, national requirement. It is requirement that 70% of the country gets vaccinated ASAP. Only after that can we think of saying goodbye to this virus. Rajiv.
Wonderfully well. In fact, the audience is so super zapped with your passionate oratory, Dr. Arvind, that they have not been asking us any question. So this is also the time for me to invite them in case they have any question, a brief question that would come in the chat box. And in the meantime, if you think that you really like the way the discussion is going about, and you have picked up some important points from Dr. Arvind, why not type Y for yes or give a thumbs up in the chat box? So let us see how many people respond to that through a chat, through claps, through thumbs up, or even just type Y so that we come to know, yes, you like the whole thing. And of course, you would be, people are saying it's superb. Arvind, a lot of thumbs up are coming, a lot of claps are coming. Thank you so much.
That's your
but do ask for your questions also, people are saying that it's a wonderful session. So let me put across another question to you in the meantime, Dr. Arvind, while people are preparing their questions. Is it true that there is also an emerging strain of virus which is affecting the lung in just 2 or 3 days' time without any symptoms? And if it is true, how can one be well informed about the disease and take a quick action?
Sorry, Rajiv, come again. I missed.
I had received a question saying that there is some kind of a virus or a strain which is actually complicating the impact on the lungs in 2 to 3 days' time.
I'll explain.
Only. Yeah.
So there was this original strain last year, and as the thing spread across the world, sometimes in September, it mutated in England and caused what is now being caused as alpha strain, which was more infective than the original strain and also had a slightly higher mortality than the original strain. That was alpha strain. A similar strain developed in South Africa, which was called beta. A similar one had developed in Brazil, which was called delta. Gamma. And then when the second wave started initially in Maharashtra, and then it spread like wildfire across the country, especially in Delhi, that was a strain which has B1617.2, which has been given the name Delta, which was highly infectious. And that's why the disease spread like so fast in our country, with 4 lakh plus cases being officially recorded every day and thousands of deaths every day. It was more infectious. And I'm still seeing the effect. We have still hundreds of people admitted in our hospital who are still on ventilators with lungs having got damage, and they're still struggling to come out of ventilator. So definitely the extent of lung involvement with this strain was more. And now we are told that there is another variation of this Delta, which is being called Delta Plus, which has again undergone some change of the amino acid sequence, which has made it escape the antibodies that we develop, or there is a cocktail of antibodies which has become available from a Roche company in US, in India, which if given very early, first, second day of the disease, can prevent the virus replication. And this Delta Plus strain is supposed to be resistant to even that cocktail which even President Trump had got. And it is probably, maybe there is a speculation that it may be resistant to vaccine, or it may be resistant to the usual antibodies. But fortunately, the good news is that most of the infections in India were caused by Delta strain. And even across the world, it's been seen in about 60 countries. The Delta Plus, there are only handful of cases reported from India, and it's only been picked up in handful of countries. Our prayer is that it dies down before it spreads across the country. So there is no strain which is specifically going into the lungs. It is the Delta strain which was responsible for the second wave in India. And Delta Plus is a newest strain, which fortunately is still in very, very small numbers. Rajiv.
I mean, people are getting inspired by the word you use, this cocktail. So they are asking whether 2 different vaccines could be mixed together to have a better impact in the form of a cocktail.
Yeah. So I expected this from the HRD network. That's, this word will excite you. So this is an
maybe I'm adding value to that.
This is an area, Rajiv, this is an area of research right now. As of today, 18th of June, there is no country in the world, there is no company in the world which recommends mixing of vaccines. So as of today, recommendation is both dosages of the same vaccine. There have been trials in England on mixing 2 vaccines, and they have noticed more side effects, etc., etc. Whether it causes higher level of antibodies, whether it causes better quality of antibodies is what we are desiring. That data is yet to come. So as of today, recommendation is same vaccine, 2 dosages. Yes, there is a theoretical possibility. You get a vaccine today and say 6 months down the line, you want to get more protection. Maybe we are expecting that by September, we will have at least 6-7 different varieties of vaccines. So there'll be a whole basket of vaccines available, and one would be able to choose. So if I have got Covishield today, 6 months later, if I wish to go for, say, 2 shots of Pfizer, theoretically, that will be possible. But that is a fresh round of vaccination. In a round of vaccination, you don't mix vaccines. Rajiv.
I mean, a very quick question which people are
Yeah,
asking.
Rajiv, can I ask you one small related to that?
Could you just put that into the chat box, please, because that helps us in terms of our continuation. Please.
Yeah. Okay,
Thank you so much. I'll take that question. Please write it there. Thank you. I mean, the quick question is that people are asking how soon the third wave is bound to come. And therefore, when it comes to people returning to offices, the question before HR professionals would be, what kind of precautions do we take if we allow people to come back to the workplace?
Very, very good question, Rajiv, and very, very relevant question. So how soon the third wave will come will depend on how we behave in the next 2 months. Be clear, the virus is still around. It is still mutating, and it is mutating to its best capacity into more infective and more lethal form. At least the virus will try that. And it will hit the most susceptible group. Last year, it hit 60 plus, which was the most susceptible group. This year, more than 40% of the 60 plus people had already received 1 dose of vaccine. So they were kind of little bit protected. So it hit the group which was on the roads, in the offices, in the social gatherings, which is the 30 to 45, the most mobile group. And that's why this year, very sadly, Rajiv, this group was the worst hit, and painfully I informed that the maximum mortality also occurred in this group because the highest numbers were in this group. Now, it was being feared that now that we have opened to 18 plus, less than 18, that is children, will be the worst hit in the third group because it was feared that they will be the least protected now that the 18 plus group is getting vaccinated. Now, in the light of that, a study which was released yesterday, which is a zero survey carried out across 26 centers in the country by AIMS and WHO, the results of which were released by AIMS Director Professor Randeep Guleria yesterday, has found almost 60% zero positivity in children who actually did not have much symptoms. So probably these children got the disease in huge numbers this time in the second wave, but did not develop symptoms, but have fortunately developed antibodies, which means they are protected. As long as the strain remains the same, a new strain does not come, they will be protected. So yesterday, this fear of children being massively affected in the third wave was put at rest to some extent by this zero survey released by AIMS yesterday. Now, my request to all is to not go into the calculation how many months later it will come, but to act today to not let it come. And how do we do that? If all of us, while unlocking the country, while going to our offices, consider that mask is a must. M for mask, M for must. We will not move out of our house without a proper N95 or double, which means inside surgical mask and outside a double layer cloth mask. That's one. No movement without a mask, number one. Number two, we will maintain distance as far as possible. Even if it's lift, avoid lifts, walk up, it's good for your lungs. So maintain distance. Three, very important for HR professionals, please don't conduct meetings in air-conditioned rooms. Please open the doors, windows. If possible, take pedestal fans and put them near the windows facing outside, or get exhaust fans put there so that the air is constantly moving out. As I said, aerosol will stay inside if there is no air movement. So please ensure good ventilation of your rooms. Do not have people having meeting in closed door rooms. That is the highest chance of transmission. And fourth, hand hygiene. And second group, go for vaccination. I say that it is our national duty to get ourselves vaccinated, get our family members vaccinated, get our resident welfare association members vaccinated, office members vaccinated, get 70% of the country vaccinated by any means. If we can achieve that, we probably would have prevented the third wave, which is more important than preparing for the third wave, which many of us seems to be doing. Rajiv.
Very well answered. Thank you, Dr. Arvind. A question which has come up is that because of distribution problem, logistic problem, there is a probability that the second vaccine may get delayed. So what kind of an impact would that have on the health of the people in case they are not able to take the second vaccine in the stipulated period?
Second dose, you mean?
Second dose, yeah.
Yeah. So
second dose of the vaccine.
As you would have noticed, these time periods are still evolving. I don't know. Nobody knows. Even Government of India doesn't know. Even the scientists don't know if 12 to 16 weeks is the best period. Maybe a few weeks down the line, we'll make it 18 weeks, or maybe we'll make it 6 weeks or 8 weeks. So this is the science which is still evolving. Every week, every fortnight, we meet, people meet, they look at the data and change the recommendations based on data. So as of today, these are the recommended things. But one thing is very clear. One dose gives you no protection or minimal protection. Second dose is mandatory. And even if it gets late, it's better to take the second dose than not take it. So even if you get late, please don't worry, but please do take second dose. Same vaccine. Rajiv.
Thank you very much, Arvind. Arvind, one of your video again became very, very popular about people who get affected by COVID and what do they need to do thereafter. And we released this video as Dekhbhal in Hindi. I'm sure for the benefit of the audience, you would like to summarize it.
So what has been seen is that people who have suffered from COVID, 90% of them, and this is not just Indian data, this is global data, 90% of them continue to suffer from some problem or the other, and they have been divided into two categories. One, physical issues, the commonest of which is weakness, severe weakness, lethargy. You come and drop dead on the bed, you just have no energy to get out of the bed or do anything. Then pains, headache, throat ache, face ache, chest pain, abdominal pain, muscles aching all the time, joints aching all the time, all kinds of aches and pains here and there, persistent sore throat, persistent cough, feeling of breathlessness, high heart rate, 110, 120, diarrhea, joint aches, then burning in the legs. So there are a whole lot of some low-grade fever, 99.2, 99.4, 99.6, less than 100, up to 100, between 99 and 100. All these are persisting. So this is physical problem. More important are psychological problems. And the biggest one is fear. Fear, डर कि मुझे कुछ हो ना जाए, मुझे clotting ना हो जाए, मेरा lung fibrosis ना हो जाए. Tremendous fear, fear of unknown, fear of tomorrow, fear of uncertainty, fear of job, whole lot of fear, stress, depression, irritability, inability to sleep, inability to concentrate, forgetfulness. All these psychological stresses are there, and these psychological stresses often lead to conversion reaction. So conversion reaction is when you start having physical symptoms due to psychological stress. So headache, breathlessness, all kinds of problem, not because of problem in the chest, but because you are under stress. Now, these are all occurring in 90% of the people. The solution is very simple. That number one, you have to accept that this is normal post-corona problems. 95% of people actually have no serious illness. They need to understand. They need to do 3-4 things. Number one, eat well. Most of the people would have lost a lot of weight in the ICUs. They again need to eat high protein diet and regain their weight. That's number one. Number two, they need to de-stress themselves. If they remain in the stress mode, panic mode, fearful mode, depressed mode, they will never improve. They need to understand that now that we have got well, we've come home, be grateful to God for at least letting you come home. Millions have not been able to come back home. So relax, relax, and relax. 95% of the people, Rajiv, will improve with this. But hidden between these 95% will be 5% who may have some problem. So what are the warning signs you should be looking for? Number one, anybody who starts having high fever, more than 100, 101, 102. If you start having that, that's a red flag sign. You need to go back and get yourself investigated. Now, number two, if there is ever a fall in saturation. Now, if you came back home on oxygen, then you need to continue, and every passing day, your oxygen requirement should be decreasing and your oxygen level should be improving. But suddenly, if there is a drop, there is an entity called pneumothorax in which the lung ruptures and the air accumulates around the lungs and your saturation suddenly drops. That problem is occurring in many people after coming home. So if there is a sudden drop in saturation, you need to go back. If your heart rate is persistently above 120, 130, or it sometimes drops to 60 or less, or if there is an or if there is a fall, a very rapid fall, then excessive cough, persistent cough, breathlessness, or sputum with blood coming in the sputum. Now, if you have, or any new symptom, so black fungus is occurring, you will have discharge from the nose, swelling in the face area, swelling in the eye, blurring of vision, drowsiness. Now, if any of these red flag signs develop, you need to go back to doctor. But if you don't have these, which is the case with 95% of the people, you just need to de-stress, de-stress, de-stress. Regulate your 24-hour cycle, start sleeping at proper time, get up at proper time, do some little bit exercise, do some meditation, make yourself busy and stop looking at WhatsApp and TV negative news. If you do all that, have some positive bend of mind, you will improve. Rajiv.
Thank you so much. In fact, Arvind, our HR professionals specialize in terms of managing the stress, and I'm sure they would be doing a good job for themselves as well as for their family members. But one last question which I would like to pick up, people have asked is, rather the second last question, another question has cropped up. What is the role of immunity boosters and also Ayurveda and homeopathic medicines in this?
So Ayurveda, I can't comment because I'm a practitioner of modern system, allopathic system of medicine. I have no knowledge and I never open my mouth in an area where I have no knowledge. So I won't say anything about that. But I do want to mention immunity booster. Friends, if you are taking a good, normal, healthy Indian diet, veg or non-veg, trust me, you need no immunity boosters, no vitamins, and no nutritional supplements. A good मम्मी का या वाइफ का बनाया हुआ ताजा घर का खाना is the best immunity booster, best source of vitamin. You don't need anything else. If you have been ill, you are elderly, you've been ill, hospital mein the, you've not been eating, maybe that small group may need some vitamin supplements, etc. Immunity boosters only help companies, they don't help you at all. And I say it with 100% certainty and confidence. Nobody has till date proved any immunity being boosted by the immunity boosters. It only boosts the sales of the companies.
You see, the trouble is today you have actually done the same thing which the footballer had done. He brought down the market value of Coca-Cola by $4 billion by keeping the Coke aside. And now you're keeping the immunity boosters aside and emphasizing on the homemade food. I'm sure it's going to disturb not many organizations, but that's the lighter part. Yeah.
Rajiv, last 3 months, there was a sale of nearly 2,000 crore as far as vitamins and immunity boosters are concerned.
Okay. All right. The last question, in fact, which is, again, you had a video on that in terms of strengthening your lung power with breathing exercises and all. Could you quickly talk about that and then we'll close the session, please?
Yeah. So, Rajiv, I have been saying that, you need to recruit and improve your lung power. And how do you do that? And very simple way, I have explained this in that video, that you sit down, just relax yourself, and then open your mouth, and first you exhale. And then you inhale and take a deep breath and deep inhaling as deep as you can. Take as much air as you can, and then freeze yourself and hold it there for as long as you can. So 3 things are important. Let the breath come out, exhale, and then through your mouth, because many people have nasal block. That's why I recommend breathing through the mouth. Take a deep breath. So I'll show you. So take a deep breath, and when you think you cannot take any further, take some more, and then hold it. And when you think that you can't hold it any further, hold it for a few more seconds. You will be able to do, and then let go. And this duration for which you have held it inside is called breath holding time. Now, when you do first time, it may be 10 seconds, 15 seconds, some may even have 40 seconds. Anything above 40 seconds is a green zone, no lung involvement of any kind. And that's why I've been saying, instead of rushing for CT or this and that, you sit and practice lung holding, because this is not only diagnosing, it is also treating. When you blow up your lung, what is fibrosis? Everybody today is fearful of fibrosis. Fibrosis is lungs contracting like this. And this is a mechanical process. And when you take a deep breath, what are you doing? Mechanically opening up the lung. You are reversing the fibrosis. So I have been saying, and I say it again with conviction here in this evening, that if you have had any kind of lung involvement and you want to prevent yourself from developing any fibrosis, just practice deep breathing and breath holding. Increase your breath holding time every day by practice. Take it to 35-40 seconds plus. And if you can take it to 40 plus and maintain it at 40 plus for the next 6 months, because fibrosis occurs over the next 6 months period. At the end of 6 months, if your breath holding time is still 6 months, I challenge if any fibrosis can touch your lungs.
Thank you so much, Arvind. This was a wonderful session where you have clarified a lot of these questions, and you have also re-emphasized that anti-vaxxers have to become vaxxers. Although there was a question to which I would respond, whether these vaccines are government approved or this is only for the emergency usages, so nobody has studied the long-term impact. My answer is yes, we haven't, because we do not know. Things are progressing at the moment, but what is vital at the moment is to go through the vaccination process so that we can protect ourselves from this problem and take care of ourselves, because staying alive is important, and in due course of time, more and more solutions will come, and the scientific world is working very hard on it, and therefore we must comply with whatever instructions come our way. Thank you very much, Dr. Arvind, for the wonderful session that you have given to us. A lot of learning for all of us and HR professionals, and I'm talking now on behalf of the HR professionals. We are indeed extremely grateful. And the question is whether the recording will be available or not. I'm sure National HRD Network would ensure the recording would be available. Otherwise, we will take the copy from them and put it on the Facebook page of Lung Care Foundation, and you can actually see that once again, or maybe share it with others. Thank you very much, friends, for joining in today. This has been a wonderful interaction with all of you. Namaste to all of you. Take care of yourself. Be absolutely safe. Namaskar.